Hey, Dr. Cohen at Backbone. I want to talk to you guys today about the Ptlms. This is the Pettibon Tendon, Ligament, Muscle Stimulator. It's kind of a mouthful. You can see why we call it the Ptlms, but even that's a mouthful, honestly. What we're going to do with this, so when a person comes in a fresh injury especially, or if they're in a flare-up of an old injury, I mean, really it's kind of the body treats it the same way. One of the things that we find, and this is kind of a big primary problem, is the muscles will be in spasm. If you've ever injured your back or injured anything, you know that the muscles tighten up around that, but in the spine especially, because our postural muscles are very specific to when they get injured, they spasm, they guard. It's one of the ways the body, helps prevent further injury, but it becomes more than that, right? So the injury occurs, injury causes pain, pain causes the spasm. Spasm actually, when it squeezes tight, it's kind of like if somebody was to squeeze the wrist really hard, right? Those muscles are in spasm, the circulation is going to slow down. So that means I'm not getting nutrients in and I'm not getting waste product out, right? And we know there's cellular waste products. I mean, that's just normal. But it's normal to get rid of them. So when the injury occurs and that spasm happens, it actually limits that exchange. And what happens is it increases the pain. So the spasm increases the pain, and then the pain causes the spasms to get worse. So this becomes this kind of perpetual cycle that we often can't get out of on our own. If you've ever had an injury that just seems to be nagging, and then it becomes chronic, the muscle component of that is a big part. So what we want to do is take the Ptlms, the Pettibon Tendon Ligament Muscle Stimulator, and we're going to work the muscle system from the paraspinals, the muscles alongside the spine, from the thoracic cage, the lumbar spine. We're going to go over the glutes or the bottom, the calves, the hamstrings. And then we do a procedure in the office here called the diaphragm pump that just kind of helps change oxygenation and changes the circulation of the body. These are part of our acute care. So this is when somebody's in a lot of pain. This is something that we do. And ironically, having a muscle, mechanical muscle stimulation, having muscle work done when the muscle is in spasm, sometimes it isn't that pleasant. People say, man, I don't really like that. See, I totally understand, but it's the thing that we have to do in order to break that cycle of pain causing spasm, causing more pain, causing more spasm. It becomes this spiral down that you won't get out of on your own. If you take a muscle relaxant, as a lot of people do, doesn't always do the trick. In fact, oftentimes because the underlying injury, if it's a back injury, especially the underlying injury isn't resolved with that muscle relaxer, so it gets a little bit better and then it gets a little bit worse and it gets a little bit better and it gets a little bit worse. This is one of the procedures that we combine with our other therapies to make sure that it gets better and it stays better. So it's going to be super loud for just a few minutes. You're not going to hear me talk. I'm just going to run it. You'll notice when we do this, I'm going to give Heather instructions as to changing arm positions, things like that for the shoulder blade movement. That's more for me so that I can run it on her without running into anything uncomfortable for her. And again, we're just going to work all the way down the body, and then I'll do that diaphragm pump, which is kind of a funny breathing, strengthening exercise. So here's where we're going to go, and you can hear, kind of loud and obnoxious, and we just go right along. Good. You want to bring the hands up for me, Heather? So the hands up position makes the shoulder blades kind of pop out a little bit. Go ahead and relax the arms down. We get into the lower back. And then the glutes, right? The butt muscle. And it's more than one, but you get the point. Good. We'll move down to the calves. Doesn't take a lot. Calves, the back of the knee just real softly because that helps us. And then the hamstrings. And the Ptlms portion of this is done. Then we're going to add what's called the diaphragm pump. The diaphragm being the muscle here, our major muscle that separates the chest from the abdomen, and it's our primary breathing muscle. It's not the only one, but it's the biggest, strongest one we have for it. It attaches in the rib cage and at the back, right about T12, the bottom of the thoracic, top of the lumbar spine. So when somebody has a spine injury and they don't have the proper curvature, one of the things that happens is that diaphragm muscle becomes overstretched and can't work as effectively as it should. So this exercise, it's kind of a funny one. So Heather's got the face paper down here. It's a little paper gasket, right? And when she's doing the exercise, I'm going to have her breathe in really hard, and it's a forced, she's going to be breathing in against my resistance. So it makes those muscles work really hard. And when we do that, I'm going to let up very, very quickly at the end, and you're going to hear her breathe in. It sucks the paper up into the face, and we always kind of chuckle because people go, oh, I'm going to suck the paper in. I say, that's how I know you're doing a good job breathing. So I'm going to just position the hands right across here, not on the spine, but directly next to it. Heather, take a nice deep breath in. Exhale that out all the way. Keep going, all the way out, all the way out. Good, good, good. Breathe in hard. And exhale out again, all the way out. Good, breathe in hard. Good, one more time, all the way out and in. And you can hear that at the end, and that's a great sign. That means we got that one just right. So that's the Ptlms and the diaphragm pump. Heather, you want to go ahead and sit up because I'm going to demonstrate the neck portion of the Ptlms as well. I'm going to stress, if you're watching this video, not every doctor does the neck this way. Some people have concerns. Obviously, there's different health conditions that we would say, you know what, you're not a great candidate for having that done in the neck area. But since I know Heather very well and I know her whole condition, she's perfectly safe to have this one done. And all I'm going to do is take the Ptlms and we go on the trapezius, the top of the shoulder here, the upper back, up the neck, across, and right back down. It's super quick. They're called the suboccipital muscles. They're the ones at the base of the skull. And right there. The other ones that we can add, when she turns her head here pretty firmly, you can see this muscle stick out. This is the SCM. It's a big Latin name. I won't bother. But we put her in this nice position here, and it brings that muscle out. It's very lightly. It doesn't take a lot of pressure. Go all the way there. The cool part, and that's kind of the normal Ptlms protocol, right? So the cool part is the tool is pretty versatile. So people come in, plantar fasciitis, jaw problems, carpal tunnel, tennis elbow, hip pointers, knee injuries, frozen joints. There's all kinds of things that this thing works for. I mean, we talk about it being for soft tissue, but it really is any tissues around any joint or any tissues throughout the body that needs improved circulation and reduced spasm. It's kind of an amazing tool, and we get a lot of versatility of use in the clinic. So there's a lot of things we can do to help you out as we move forward with the Ptlms.